This is the Cerebral Edge with Coach Chris. I'm here again with my esteemed colleague
and friend,
Dr. Jim Weathers.
yeah.
And friend.
Yeah.
And chiropractor, physical therapist, rehabilitation to a lot of elite athletes, travels around the country.
I've been blessed.
And it's been hard to get you actually on this podcast because you are everywhere.
Well, yeah. I mean, I can say I wish I had been sooner, and I do. Mm-hmm. But yeah, I've been quite busy and traveling the country, and so. But here I am, man.
Duty calls, man.
It does. And I wanted you to know, not only did I have it on my calendar to be here, I made sure nothing interfered. So
that makes me feel very strong.
I hope so.
I'll tell you.
Yeah.
It does. Hits me right here. Anyway, so last time we were talking about biohacking, right?
Yes.
And again, we're going to roll into this, talking about biohacking once again. So again, recap, what is biohacking
So again, biohacking is a way that many individuals will try to create a quicker healing for their body or help their performance be better, and also trying to just have a more overall health and wellness compared to what would be normal to another person. A lot of times it's because they need more from their body if they're competing, or they may have food allergies, or et cetera. So, but it's a systemic way to a certain part of your body, a certain part of the cells, or a certain mechanism and function that you're trying to enhance, so that it affects the whole physiology of your body and the outcomes of what it is that you're trying to do.
So basically enhancing your physiology and nervous system to
a lot of times. Yeah, I mean, anywhere from the gut health to the mental health to overall just peace and rest and all for the body.
Okay.
Yeah.
So what are some other ways, I mean, we discussed some before, but what are some other ways now that you implement that to get your athletes back on the field quicker?
So during our last conversation, if they haven't seen it, go back.
Go back. It's a good one.
It is. It was fun. So yeah, we talked about PEMF, pulsed electromagnetic frequency, and that was one of the ways in our and we utilize with our patients in our office, because we're trying to, again, get the circulation to the cells of the tissue. Just because you do an IV with the nutrients or taking the supplements or even medications, you're saturating your body with those nutrients or meds, but it doesn't necessarily mean that it's being utilized by the cells. Okay. So it's there, but it's not quite. So with the PMF, we use it to make it more efficient. So here's a quick, just to summarize that to make it better understood. Do you have a favorite restaurant?
Favorite restaurant?
Yeah.
Yes,
okay.
I do.
Okay, so at your favorite restaurant, I'm sure they do food and drink, because that's why it's a restaurant.
Of course.
Duh. Okay.
I'm a whiskey guy, so it's got to have some drinks.
Absolutely. So at this restaurant, they contract with a food company to deliver the food and drink to that place. So of course they can have that function of generating revenue. So if that food is delivered and stays in the kitchen or in the prep rooms and does not get out to the tables to be consumed or utilized by the customers, it doesn't no good. I mean, it's being delivered.
It's there.
So it's the same as you're taking the nutrients and you're taking the medications, et cetera. But if it's just because it's in the body or in the restaurant, it's not being utilized by the customers or the cells, then what's the point?
What's the point?
And so when we utilize the PEMF as part of our therapies, we're doing that act as the waiters to deliver the food and nutrients to the table to be consumed or utilized by the customer and or, in this case, the example, the cells of the tissue. But it even goes the next step further, because I'm sure your favorite restaurant doesn't just serve one time a day.
No.
So they obviously want the turnover of the table so they can generate more revenue with more people consuming and utilizing the food that they have.
Perfect.
So they have another staff that comes, and sometimes it's the waiter or the waitress, but usually it's someone else, comes and clears the waste off the table. Well, that's what this device does. It helps with the circulation to not only bring the nutrients in, but also to bring the cells and all in your bloodstream to help pull away, like the white blood cells and all, to pull away the waste and toxins. So again, that cell rejuvenates much quicker. So that's how we utilize it, and that's a benefit we have with our athletes while they're in our office. We can do that type of treatment in addition to the other therapies that we're performing to help with their tissue repair. So let's say the patient is out of our office. How do we biohack them then? Well, one of the ways that we utilize biohacking to help patients outside the office is that we will, excuse me, do a technique called kinesiotaping.
Okay.
Now, a lot of people, most people are familiar with it now. They'll see athletes with color tape. A lot of times it's black, but it can be a color tape.
My favorite one is the one girl, she's like sprinting and she has tape all over it. Said, maybe you should sit this one out.
Yeah, and it's kind of funny because when I've come across some people that don't understand the principle behind it, I'm like, what are you treating? It's
What is going on,
you got
man?
a discount on the tape, didn't you?
Pretty much.
Yeah, exactly. But that's one of the things again that you can utilize the kinesiotape between the office visits to help improve and continue that flow of better circulation to the cells. So I can tell you the concept of kinesiotaping if you...
Yeah.
Okay, I figure you might ask.
Yeah, absolutely.
I'm just jumping ahead.
That's what I like about you.
I know, right?
You always think ahead.
We do. So the kinesiotape, what is unique about this tape, I mean, most people, when they think of athletic tape, it's white, and wrapped around the wrists, et cetera. But this particular tape, it actually, when you look at it, it stretches. Now, depending upon the manufacturer, it depends on how far it actually stretches. But on average, it's usually a stretch up to an extra 70 to 100% of what it is originally in the relaxed state. So the theory behind it is that when you place the tape stretched onto the skin, it wants to recoil back. So it's like a rubber band. You stretch one in and you release it, it recoils back. So that the design of that tape again stretches. You put it on the skin, it recoils. So the therapy of the tape is twofold. The first one is we'll do the taping to help with the pain and management. So there's an injury there, and a lot of times it's one spot, like the shoulder, or sometimes a region area. And so we'll place the tape, and depending upon the percentage you pull, depends on the therapy protocol you're actually trying to get for that goal. But that's a whole nother program. But we stretch it out and we place it on it, and it recoils back. Now, when you have an injury, you have the body's response. Again, we talked about last time about that parasympathetic, that guarding, And so what happens is that the muscles will tighten. And so if the muscles tighten, you have the skin, like you're in the room, which we are. So you have the skin that's the ceiling. You have the muscle on the bottom and the fascia, or that tissue layer that rests on top of the muscle. That's your floor. So in between those, the ceiling and the floor, the skin and the muscles, you have the circulation that brings the nutrients back and forth with the arteries and veins, or the capillaries, going back and forth to the cells. Then you also have the lymphatic system that is used, it's kind of like the pipes that draw out swelling and edema, all right? And then you also, of course, have the nerves that not only tell the muscles how to move, but also will relay pain. So again, that room, the ceiling, the floor with the muscles. So when you have an injury, the muscles swell up and protect. You get extra swelling in there, and it compresses against that circulatory system, which if you, like in the backyard of your house and the water's flowing through your hose, you squeeze it, it slows it down. So with that compression, it slows down that circulatory system. But it also does the same thing for the lymphatic system. But it also presses on the nerves that can cause tingling and or pain. So when you put that tape on, remember, it stretches, you put it on, and it recoils back. And so it lifts the skin.
Gives a decompression effect.
Exactly. It creates more space in between, which allows the circulation, again, because it doesn't have that pressure anymore, it allows that circulation to bring the nutrients in and pull the waste out, which we do, again, with that PEMF device. But again, outside the office, this is a great way for them to help with the circulation. But it also decreases that swelling because it allows that lymphatic system, that hose and piping that draws out the swelling edema, to also flow that out and takes the pressure off. And the pressure then is also off the nerves. And so it helps tremendously. I mean, in some cases, we've had, and I wish I could say it for every patient, but in some cases, in just a matter of minutes, they can tell the difference. But again, it's something that they wear in between their visits to help them with the pain management. Now, I said it has two functions of that tape. So the second function for the kinesio tape is, again, depending upon the stretch that you do, the direction, you know, that all comes with more training. But muscles will react to various stimuli. Actually, the whole body does. So we have a defense mechanism in our bodies. Light touch, hot and cold temperatures, vibration, those are all defense mechanisms that we have. So, for example, you touch something hot, you pull your hand away. It's usually the fact that you felt the heat and then pull it away. And that, usually about a second later, is when you feel the pain. Because pain goes through the nervous system slower than that defense mechanism, and it's designed that way, again, to protect us. So one of the things, again, that with the tape being resting on there, that causes those neuroreceptors in that area to feel that pressure. And depending upon if the pressure is pulling one direction to help with the muscle to help it be better, or it pulls another direction to help it not work as much, you're able to help re-educate that muscle to either facilitate to work more efficiently with the other group, or to not work as hard so these other muscles can help recover with their part of their rehab and therapy. So again, we're able to help with the pain management in between the visits, as well as help re-educate the muscles, which leads into their physical therapy of retraining to get them back much quicker. Those are just a couple of examples that we use in our office of biohacking.
Excellent. And then when you use that tape, I've used it with a few people where they could not literally do like something like a curl. And they put the tape on, and then they couldn't start to do light curls. So that's actually re-education, neuro-re-education, that muscle to be able to fire again.
Exactly.
Because it's decreased that threat mechanism.
Yeah, exactly. And that's the whole point, is you get the body to respond as quickly as possible back to that pre-injury state, because if you don't correct those types of things as quickly as possible, there's other patterns that will develop that will lead off point. And you start getting other chronic issues because one muscle group is overcompensating for another, because that one that was injured wasn't rehabbed properly, or re-educated to fire off in the pattern it's supposed to. And so when you start getting off on a tangent of that misfiring, now you're dealing a lot more with the joint wear and tear issues. You're dealing more with the opportunity of re-injury or even a new injury, et cetera. So it's important, like you were saying, you know, if you can get that muscle to respond much quicker, it just benefits not only that moment of that healing, but also the long-term decrease of re-exacerbation.
Yeah, absolutely. And the PEMF, right, that we talked about.
Pulse electromagnetic frequency.
Right? That not only helps with the capillaries, but it also sounds like it helps with the lymphatic system a little bit.
It does.
Right? Because the lymphatic system doesn't have a pump.
No.
Right?
And that's interesting, because in the first episode that we had talked about, I talked about that sine wave that was complex. It was lower and much wider out, and then as it goes on, it gets closer and higher peaked. And what it ends up happening is, so the capillaries that feed into the cell, they're actually independent from the heartbeat of how that circulation gets pumped in. It's independent. It's part of the autonomic nervous system, which means you don't have to think about, you know, making sure your heart's beating. You know, this does it automatically on its own. Unfortunately, with injuries, us getting older, the fact that we have a bad diet or don't exercise, those capillaries decrease in function. And that's why you'll start seeing cells break down and then tissue break down, and that system eventually breaks down, and then you get symptoms. So trying to make sure that those capillaries are working is very important, and stay functioning. And so that frequency affects, there's a small muscle around each capillary right at the end. And it can't line the whole capillary, because if it lines the whole capillary, the nutrients can't leave the circulation into the area of the cells that it's trying to feed into or pull the waste from. So I tell people the capillaries are like the front door or the sidewalk leading to your front door of your house, or leading into the cells of the tissue. And all the rest of the circulatory system is part of like your interstates and the state highways and the county roads and the roads leading in. You know, those are all designed to get you to a certain destination. But once you get to that destination, you need to be able to get in, and that's the walkway or the door. That's what the capillaries do compared to the rest.
Right.
So that frequency is geared to help that muscle pump more efficiently. But what also happens is that it affects what they call the interstitial space. So you have space between all these arteries and veins and the cells and et cetera. And that frequency also affects those, which is where the lymphatic system rolls. And so that frequency not only helps with the circulatory system, but it also helps with the lymphatic system.
Excellent.
And you get improvement because, like you said, it doesn't have its own pumping system, but it gets activated more efficiently with that frequency.
Okay, sweet. So we have, you know, the PEMF working, which is helping the blood flow, and then we're having the kinesiotape, which is helping the nervous system, like lift that protective mechanism off the muscle, right? Pulls that muscle up, allows those nutrients to flow into where it's needed, where it's damaged. So you have like a perfect combination right there to help an athlete get better. Yeah,
and what's great is that, again, that works great in office, but when the patient leaves and tries to be as active as possible, now they're getting therapy outside the office,
so it's
which is a key. Yeah, absolutely.
Yeah, perfect. Excellent. Well, this is my friend, Dr. Jim Weathers.
That's it.
Therapist for a lot of elite athletes, helps them get on the field better, play better, lets them decide when it's their time to quit, not have other doctors say, hey, you need to stop, which I think is pretty much outside the realm of a doctor to tell you that almost, right?
Yeah,
There's kind of a fine line,
but
for the most part, like if it's just a bunch of injuries racked up, the last thing an athlete wants to hear is you're done.
Exactly,
right? So they want to have that autonomy to quit on their own.
Right, exactly.
And it's very hard for a lot of athletes too, and it's a very different mindset than a lot of other physical therapists and chiros have, because they'll tell somebody, hey, you need to stay off this for 2 weeks, and an elite athlete, you tell them that, they're like, whoa.
Well, their time of play actually is very short, comparatively to most careers that people have outside of professional sports and elite sports. So having to sit out 2 or 3 weeks could feel like months to someone that doesn't have that short time period that pro athletes have. So getting them back in the game until they're ready to leave on their own terms. That's what we say.
So if you're an athlete, you're feeling injured, you're feeling banged up, how do they get a hold of you, Dr. Weathers?
Well, it's the best way to get a hold of me, unless you have direct access with the teams and trainers we work with. Look on social media. My office is Chiro Fitness and Rehabilitation Center. Check any of the social media platforms, and there's ways to message me directly through that.
Awesome. Thanks for coming on.
You're very welcome,
It's been a pleasure to have you.
I'm glad I was here, man.
Yeah, man.
I'm sorry. I am sorry it took me so long.
Oh, man, it happens. Like you said, duty calls. You're a busy man, traveling all over the country. Not only that, but you also teach kinesiotape as well, right?
We do, yeah. I have advanced certifications with that, and I've taught many therapists how to utilize it and use it and combine it with other forms of therapy, such as the PEMF device with that. So, yeah.
Awesome. This is Coach Chris with the Cerebral Edge. Stay strong.